Yes. Hi, my name is Luis Zavala-Arciniega. I am a PhD student in epidemiology at the University of Michigan. A little of my background, I studied medicine in Cuba, and Cuban medicine centers the training of doctors in family doctor's office. And from there, medical students are integrated into the public health systems. This experience was very relevant for me because I came to understand the importance of empirical data and participatory research. This catalyzed my interest in public health. Then I came to Mexico and I started the Master of Science in Epidemiology at the National Institute of Public Health in Mexico. At this stage of my career, I study population strategies for the control of non-communicable disease, expanding my knowledge of methods to examine social determinants of health, including conceptual and statistical approaches to analyze multi-level effects on public health problems. In 2014, I met Dr. Miriam Reynales in a class on how tobacco control policies can improve population health if adopted and implemented correctly. She leads the Department of Tobacco Research at the National Institute of Public Health, and we worked together on my thesis to evaluate determinants of tobacco use among Mexican adolescents. Through this project, I became passionate about conducting policy-relevant research on tobacco use. My interest and skills to research on tobacco was furthered during a one-month research stay at the University of South Carolina. I was hosted by Dr. Nancy Fleischer and Dr. James Thrasher, who leads the team of tobacco research at the USC. They helped me to develop the methodology of my thesis. The main results of this study showed that secondhand smoke exposure, that having a job during the early adolescence, or not attending to the school during the early adolescence were essential determinants of tobacco use among Mexican adolescents. We received a scholarship to present this work at the 17th World Conference on Tobacco or Health, which was in South Africa in 2018. Since 2015 to 2019, I work as a researcher at the Department of Tobacco Research in Mexico. I work at the Mexican National Survey of Drug and Alcohol and Tobacco Use. This is an ongoing large national representative survey that provides critical data on surveillance on tobacco use. It was a beautiful experience for me because my role consists in coordinating the epidemiology team that designed the tobacco section of the questionnaire, also training the interviewers, supervising the field work, conducting a statistical analysis, writing the final reports, and some papers using this survey. Through these projects, I started working with Dr. Rafael Mesa and Dr. David Levy, providing inputs for different simulations models to estimate the impacts of different tobacco control policies in Mexico. I was admitted to the doctoral program in epidemiology at the University of Michigan in 2019. And since then, my work with Dr. Rafael Mesa and Dr. Nancy Fleischer was extended. And currently, I am working at CAsToR on Project 1 and Project 3. In particular, I am working on a research paper that explores the patterns of flavoring in cigarettes and e-cigarettes simultaneously. We have preliminary results of this work that we present in the Tobacco Regulatory Science meeting in 2020, and we expect to use these results in simulation models that can help us to understand potential flavor restrictions. Moreover, we have the plan to extend our work to smokeless, to cigars, to exploring the flavors in these products and also the combinations of flavors among dual and polytobacco users. Finally, given the tobacco market continues evolving, my advice for others who want to enter in the field of tobacco regulatory science is that the field needs scientists that work hard in generate evidence that can help to implement tobacco control policies that can respond to the current complex of rapidly change of nicotine products. And with this, thank you very much for your time. Bye.